Anyway, I want to show another answer that I thought was really good and more specific, which frankly he did not answer this the right way in the first debate or in interviews I've seen. So let's take a look at his answer on Medicare for All.
In creating a system like Medicare for All through a bit of a higher tax rate?
Well, how do you think healthcare is not free? Right now, we pay for healthcare in a variety of ways. Pretty complicated. About half of healthcare dollars, more or less, comes from taxes. That's what Medicare is about, what Medicaid is about, what the CHIP program is about, what the Veterans Administration is about. So you already spend a lot of money on that. The other way we pay for it, we don't call it taxes, we call it premiums. We call it out-of-pocket expenses. Increasingly in this country, people have higher and higher deductibles and higher co-payments. That's how they are paying for health care. So what we're saying is, when you walk into a doctor and hospital, there is not going to be any premium, no co-payment, no deductible. You're going to long-term health care as well. We're going to expand Medicare to cover dental care, hearing aids, and eyeglasses. You're not going to have to pay out of your pocket. You're not going to have to pay premiums. What are you going to have to pay? Yes, you're going to have to pay more in taxes. But at the end of the day, just hypothetically, if I say to you, Bob, that instead of paying $15,000 a year for your family in premiums and out-of-pocket expenses, and I'm asking you to pay $10,000 more in taxes, you're $5,000 for the good. You'll say, thank you very much, Bernie. And I think a lot of people in this country
Well, is there anything...
So what was missing in the debate was that explanation. He did not say, hey, establishment toady reporter, if you spend $15,000, if you spend $15,000 here for healthcare costs for you and your family, and your taxes go up by $10,000, well, if that $15,000 goes away, and you have the $10,000 left, you save $5,000. He didn't explain that in the first debate. That overall, when comparing the taxes you will pay to the healthcare savings you will save, you're going to be saving $4,000 to $5,000. That was not in his first answer. Bring a Karl Rove whiteboard if you must. I mean, Karl Rove is a degenerate, but so be it. Bring a whiteboard if people can't understand it, because obviously the moderators understand this. They just want to spin it and make propaganda out of it to confuse people. But you're not actually raising taxes on the middle class, and Bernie actually needs to keep making that point. You're already paying more taxes on health care. It's just not called a tax. I mean, I just got a bill for $300 for co-insurance for anesthesia from my back surgery. Is that, I don't care if you call it sliced bread. It's money I have to pay. Is it a tax? Is it co-insurance? Whatever. But finally, you gotta break it down for people, and frankly, be a little bit more forceful. In this case, this reporter was not like adversarial, but to the moderators, I would say during the debate, Rachel, or who's doing it, Jake Tapper, you got an army of producers here, so let me break this down for you. It's not complicated. If you got $10,000 in tax increases, but before that, you got $15,000, doing my Bernie impression, you got $15,000 in healthcare costs. Well, if those healthcare costs go away and you're left with paying $10,000 more in taxes, what's the difference between $15,000 and $10,000? That would be $5,000 in savings. Sounds like a good deal to me. So I thought that was a great answer. Also, he's taking it to Biden a little bit stronger. Let's take a look at this part.
Everybody in this country has a card which allows them to go to any doctor they want, any hospital they want, and which will end up costing us far less than the current dysfunctional system. The key question that we as a people have got to ask ourselves, do we think that we should continue a healthcare system designed to make huge profits for the insurance companies, drug companies, and others, or do we have a system which is universal, every man, woman, and child, that is in it and is run in a much more
Vice President
cost-effective way?
says his words, your program would be too risky, that people would transition over to Medicare for All and they'd lose coverage.
I like Joe, and I hope we will have this debate, but when Joe says something to the effect that Medicare for seniors, what did he say, will end? I mean, that's just an obviously absurd situation. Let's think back for a moment. Let's think back. In 1965, LBJ and the Democratic Congress began Medicare. Today, Medicare is an extremely popular program, far more popular than any private health insurance program. They began that back in 1965 before we had anywhere near the kind of technology we have today. Started out of nowhere. And then people say somehow or another, with all the technology we have today, all the experience we have with running a Medicare program over the last 50 years, that somehow we can't, over a 4-year period, go from 65, which is eligibility right now, down to 55. Bob, do you know how many millions of people who are 60, 62 years of age would give, how do I say this, their left arm to get into a Medicare program? They're hanging in. They're waiting for Medicare. If we can lower that age from 65 to 55, down to 45, down to 35, and then cover everybody, this is exactly, I think, what the American people want.
I thought that was a good answer. I prefer, instead of absurd, maybe just say, well, he's lying. That's a lie. That's Republican talking points that Joe Biden is using. Just here, and full disclosure, I'm just taking this from Bernie Sanders' campaigns, an email they sent out. But, I mean, these are the numbers. Compare the two plans. Bernie on the left, Biden on the right. Obviously, Bernie's plan covers everybody. Biden's plan estimates leaves out 10 million people uninsured. I think that's a low number as far as 10 million people uninsured, because how many more people are going to have expanded Obamacare but still not be able to afford it? So you could say 10 million people totally uninsured, but there's a lot of people with Obamacare that are technically insured that cannot afford it. Obviously, Bernie's plans eliminates copays, deductibles, premiums. Biden's plans, tens of millions of Americans remain underinsured with high copays and deductibles, leave too many people at the mercy of insurers. Then you got Biden's plan, basically leaves people at the whim of their employers. So you got 100 million Americans would remain dictated by their employer to keep their insurance. They could lose access to their doctors if they're separated from their jobs, which an estimated 66 million Americans were in the last year. Or the employer could change their coverage without their input. As one study found, almost 30% of employers changed coverage last year. Then you have a public option under Biden will be too expensive for those who need it. Biden wants to keep the complicated system of health insurance premium tax credits and means test eligibility for premium-free public coverage. Let's ask the people who just barely missed qualifying for Medicaid today how that will work for them. And obviously Biden's plan preserves a broken system. And by the way, why does Joe Biden really want a public option? Why is he saying a public option, which frankly won't be a true public option, and I'll tell you why in a little bit. Why is it that he wants a public option? Probably because all the Wall Street banks that are heavily funding Joe Biden are also heavily funded in big pharmaceutical companies, hospitals, and the for-profit health insurance system. Could it have anything to do with that? This is never discussed, but the banks, Goldman, Wells Fargo, JP Morgan, Bank of America, all of them, hedge funders, lawyers that represent financial institutions, which are some of the biggest donors to Biden, Harris, Buttigieg, they're all invested in the for-profit healthcare system. So you think Joe Biden's going to be, railing for Medicare for All while he has caviar and champagne on Park Avenue? Jen, how many emails do we get a week where it says Joe Biden scheduled for today, because we're on the press list, Joe Biden has a finance event this evening. Finance event, a.k.a. figuratively sucking some for money. Excuse my French. This is why he does not support Medicare for All. And, Biden takes every opportunity to cite his BFF, Barack Obama, President Obama. Obviously, he's doing that to win the black vote. I'm sorry, but this is politics. He wants to wrap himself so tightly around President Obama that Obama can barely breathe. And Obama has not endorsed him, mind you. But, Joe Biden mentions Obama as much as Donald Trump tweets racist things. A lot. So Obama himself, a couple months ago at a speech, said, well, Medicare for All is a good idea. And if Joe Biden has to go the lengths of lying and saying, oh, well, it's millions of people are going to be without health care in the transition. Bernie Sanders, the transition is over 4 years. Nobody's going to be without health care. Obamacare is not going to be dissolved until this system is fully in place. Bernie Sanders has never said, I'm going to snap my fingers and we're going to have Medicare for all. That's not realistic. It's a huge change in the health system.
Hope you enjoyed that last video. Hop on over to statusquo.com where you can sign up for our email list and become a member for as low as $5 to $10 a month. Membership is how we grow. That's statusquo.com/join. And remember, join our email list so we can grow the revolution with you.